Alright, now we're going to go into the appendicular skeleton. Those are our appendages. The first bones these are the upper extremities. So we're going to go shoulder to shoulder in that area. So the first bone we're going to look at is the scapula. The scapula is an oddly shaped bone. The main part of it is the body of the scapula, which is sort of what we hold. And then when we look from the back, we got this big bump here, and that's known, or this ridge, and that's known as the spine of the scapula, creating a supraspinous fossa and an infraspinous fossa. We have a few borders. We have a medial border here, or also known as the vertebral border, because it's nice to right next to the vertebrae.
Lateral border
here, and we have a superior border here. The inferior border, or actually the lateral border, I'm sorry, the lateral border is also known as the axillary border, because it's right to the axilla, the armpit. We have an inferior angle made by the lateral and the medial border, and we have a superior angle made by the superior border and the medial border. When we take the spine of the scapula and we move all the way out laterally, we come to a tip, and that's known as the acromion process, or the acromion. And then when we look on the inside a little bit more, where the humerus comes in, I'll maybe show it on a scapula that is free, that where the green felt tip is where the glenoid cavity is. That's where the humerus, the upper arm bone, comes straight in. And then we turn this, our nice bonita, around, and in the front we have a tip, and that tip is called the coracoid process. Like coracoid, because it's like a raven that sits right there on top of the wedge. And we go to the clavicle. The clavicle, we sort of have an end that's rounder and an end that's flatter. If you look at a clavicle alone, we have an end that's rounder and we have an outer end that's flatter. It's an S-shaped bone. This is very nice the way it shows the S. The rounder end is where we attach it to the sternum, specifically the manubrium. So that's known as the sternal end. The outer border, where it's flat, it articulates with the acromion, so we know that as the acromial end. Look at the humerus, and the humerus has a round piece to it, and that's the head. Like everything that's round in the body is probably called a head, more or less. And then right after that, it narrows a little bit, and that's known as the anatomical neck. Then it has to jump over a few bumps, and then it becomes very slender, and that is known as the surgical neck, because that area breaks more frequently than up here. So we have two necks in the humerus. And then the bumps, there's two bumps. There's one bump that's bigger, that's right out here in the front, anterior, and then there's one bump that's a little bit smaller. The bigger bump is known as the greater tubercle, the smaller bump is the lesser tubercle, and in between we have a groove, and that's known as the intertubercular groove, and sometimes also called sulcus. When we go further down, we have a little bit of a roughened area on the outside, about midway down on the shaft, laterally. That's known as the deltoid tuberosity. Ligament-wise, off the shoulder, we have a model here. We have the real specimen in this area here. One very strong ligament that we need to have intact is known as the Acromioclavicular Ligament, that goes from the acromion process to the clavicle. So that's right up here, or on this specimen, it's right here. It's right on top of your shoulder. Ligaments are often named by the bones that they attach to, which makes it really nice and somewhat not too difficult. For example, the ligament here that's indicated as a C is the coracoacromial ligament. That would be right here from the acromion process to the, from the coracoid process to the acromion process. And then we have two ligaments that go from the coracoid process to the clavicle, and those are coracoclavicular ligaments. And then, since this is a synovial joint, around the whole joint, or here we can see it mainly in the back, nice and continuous, we have a joint capsule. In the humerus and the shoulder there's more ligaments to it, but for right now that's enough. Alright, so let's do some muscles right now. I like this specimen here to show muscles actually, because, especially this side, because we have indications of where the muscles attach. So one muscle that I like here is the Levator Scapula that attaches at the superior angle of the medial border, or the superior part of the medial border, and it goes into the cervical spine. Levator Scapula. It elevates the scapula. Very strong anchor of the scapula. And that muscle starts right in here. I don't know if you can see that, where it's blue, at the medial border of the subscapular fossa. And it wraps around, and it goes around, and it comes and anchors into the ribs. It's known as the serratus anterior muscle. And that brings the scapula forward, and it holds the scapula against the chest. In the back, we have a couple of muscles that are below the levator scapula. They're right here from the medial border, and they go into the vertebrae, into the spinous process of the vertebrae actually, of the thoracic spine, and those are known as the rhomboid muscles. The rhomboid muscles adduct the scapula, and when we see how they will move the scapula this way, and that's known as a downward motion, downward rotation of the scapula. The pectoralis minor muscle comes from the ribs right here and anchors into the coracoid process. What that one does, it depresses and protracts the scapula, or the shoulder itself. It rotates the scapula this way a little bit if it contracts. That's inferior, but it also elevates the ribs this way if the scapula is stabilized. Now let's do a little bit on the rotator cuffs. So the rotator cuffs are the sits muscle. These are synonyms. Those are the muscles that primarily hold the arm, the shoulder, and the arm into the shoulder. So they come from the underside and the outer side of the scapula, and they pull the humerus in. So we have three of them in the back. We have the supraspinatus that lies in the supraspinous fossa. We have the infraspinatus that lies in the infraspinous fossa, and we have the teres minor that starts right at the lateral border of the scapula. All of those three muscles anchor into the greater tubercle of the humerus. They hold that humerus in like that. Then on the underside, on the infraspinous fossa, the subscapular fossa, sorry about that, from the subscapular fossa we have a muscle that's called the subscapularis, and that moves to the lesser tubercle of the humerus, and it pulls the humerus in from the front.